ncIMPACT is made possible by funding from Civic Federal Credit Union and is a public media North Carolina production in association with the University of North Carolina School of Government.
I'm Anita Brown-Graham. Welcome to ncIMPACT. COVID-19 is affecting our lives, our jobs, our schools. This crisis is leading us to revisit some important statewide topics that now require new solutions. This week, we're looking at how the crisis affects young children. Joining us are Sharon Hirsch, CEO of Prevent Child Abuse North Carolina, Dr. Jennifer Green, Cumberland County Public Health Director, and Paige Rosemond, Wake County Child Welfare Division Director. These panelists have interesting ideas about addressing what are called adverse childhood experiences, and they want to hear your ideas and your questions. Early childhood experiences matter. The Get Set Transylvania program in Transylvania County is a collaboration of community partners that work together to improve the support for children and caregivers in the county. ncIMPACT's David Hurst reports.
Home to hundreds of waterfalls and miles of mountains, many moved to Western North Carolina to slow down and enjoy its richness and beauty.
Ooh, let's be a rubble and dig.
It's one of the main reasons Katie Sanders and her family chose to live in the mountains.
Life is slow here. People they get outside. It's just kind of down to earth really here.
That's dirty, but under the dirt, what color?
When Katie's daughter Tilly was born, they were living in Jackson County.
So I just started to look online for programs like support groups for moms and meetups and things like that, and I couldn't find any near me.
So she looked in neighboring Transylvania County and found plenty of options.
Yes!
Katie and Tilly made the hour drive just about every day for a year until they decided to move here permanently.
Things just kind of fit together. They have a great reputation for raising families. We would come downtown to the festivals and there was always families everywhere. People were friendly. It just was like, yeah, we need to be here.
So welcome to Storytime.
Families are moving to Transylvania County in large part because of its reputation as a great place to raise children.
So I thought that we would start off today with a song about colors.
County leaders began putting an emphasis on early childhood development in 2015.
Wave your scarf fast and slow, fast and slow, fast.
At the time, they discovered parents struggled to find pre-K and child care options in the area. In an effort to come up with solutions, a county commissioner invited 24 local organizations to talk about these issues over lunch.
They all showed up. It was an overwhelming response. And it was so fascinating to get everybody in the room together for the first time. They'd never had that chance before.
Sharon, let's start with you. We know so much today about the importance of productive early brain development for positive lifetime outcomes for our kids. How are communities supporting their young children and caregivers during this pandemic? And what are your primary concerns about adverse childhood experiences today?
Thank you, Anita. It's actually really hard to support young children and their families right now because most families are at home and are more physically distant and socially isolated. There are lots of different ways, though, that communities are stepping up. So many communities have been stepping up through their school systems to provide food to children that aren't going to school or to child care centers every day. Parenting, education, and home visitors across the state have really had to pivot pretty dramatically over the last couple of months to think about how do you support families when we can't go to places where families congregate or where we've traditionally provided parenting supports. And so folks are starting to figure out how do you use Zoom and Facebook and things like FaceTime to actually continue to stay connected to families. So many organizations across our state are starting to use the technology to stay connected, particularly to provide parent supports and connect them to other community resources.
So that's on the positive side. On the not so positive side, talk to us a little bit about adverse childhood experiences and what What are those in the midst of a pandemic?
Well, adverse childhood experiences happen all the time, unfortunately, and they are common things that happen to children across the spectrum that include abuse and neglect, the things that our organization is really concerned about, exposure to substance abuse, and other issues in the community. We're really concerned about it, particularly now, because it's creating more trauma. We know more children may be isolated at home with parents where it's not safe and the families aren't getting the support they need. We know parents that are losing their jobs may be more financially stressed, and that's a continuing concern. So our need to support and strengthen families within their communities is really critical to helping us solve this problem, because social isolation and family financial stress are two of the biggest risk factors for child abuse and neglect.
So, Jennifer, let me go to you next. We've got a question from Greg in Durham, and he points out that according to a recent survey, 41% of adults in North Carolina have delayed getting medical care due to COVID-19 in the last 4 weeks. So how does a parent putting off taking care of themselves impact their children?
So we know at the local health department level the importance of prevention services. And right now, that's what we're seeing, is that parents might have to make that tough choice to delay a prevention visit, whether that's a dental visit or whether that is a family planning visit for themselves, or a well child visit for their son or daughter. And we are going to see the impacts of that later down the road. We don't know what that's going to look like yet, but we're anticipating that we'll see some adverse outcomes because of that. So, 9 months from now, when people are missing family planning visits, what does that look like for our community in terms of unplanned pregnancies, and certainly what is the impact of unplanned pregnancies on our community for child abuse and the well-being of that parent and well-being of that child. So for us at the local health department, it's been very important for us to make sure that to the best of our ability, we're still maintaining those preventive visits, even if that means meeting via Skype or a telemedicine visit.
Thank you. Paige, Anna in Valdez wants to know, and of course you're working with lots of families in Wake County, how do we help families make sure that they're prepared to support their children with remote learning when it's required?
Well, and we really know that healthy parents and safe parents equal healthy children and safe children. At Wake County Human Services, we've been hosting support groups virtually to support parents and caregivers that are maybe learning technology along with their children and providing remote learning. Especially with our older caregivers, we have 20% of our children in foster care that are living with relatives. And this is very new to them. And having to manage their own household while having, and I can say for myself as a mother of a preschooler as well as a school-age child, it's challenging. So beyond just the technology, wanting to provide them support and that it's okay if we don't get it right. And to lessen that stress and to be a support to them, an ear, a sounding board. We've really increased the number of check-ins that we're doing with families, much to our effort in trying to prevent the likelihood of child abuse and neglect, as Sharon was referencing earlier. With increased stressors often comes a greater likelihood of parenting that is punitive or could later result in some type of miss or maltreatment. So we really want to be there for our families from the very beginning and help to predict concerns and be available, even though we're not there in person, definitely using more phone calls and video conferencing to know, so that our families know that we're here for them.
And so Deborah in Morganton, I'm going to stick with you for a moment, Paige, asked a follow-up question, which is whether there are any plans in place for supplemental instruction support this summer for students who need extra help. Do you know?
trying to remember the emails that I have received as a parent. I'm not sure what that looks like. I know that there are some summer camps and online resources to be able to provide additional supports to families that are wary about the summer months and losing that educational time.
And this again is a follow-up, so you can see that our audience, which is really vast today, we've got almost 1,000 people who signed up in advance of this Facebook Live event. Zia in Transylvania County asked, and I'm going to send this to you, Sharon, whether there are particular opportunities for at-risk preschool students to attend summer programs once things open up a bit to help them get on track for kindergarten. Do you know?
You know, I don't know. We know that there are a lot of agencies that are trying to figure out what summer camp is going to look like, but we're not hearing yet what those programs and what their availability will be. And that's a real worry.
I'm going to go to you, Jennifer, with this next question, which is, what is the best way to address mental health for children and teens throughout the pandemic?
So the Triple P Parenting Program has some great resources. So I'd encourage the audience to go online and Google or type into your search engine Triple P Parenting and COVID-19, and they have actually a list of 10 things that you can do as a parent to assist with in this time. And one of those is to reassure your children that they are your priority and that they are important to you, and that it's okay to say that you don't know the answer to what's going on in the pandemic, and that you don't have all of the information, but you can help them seek out some of those credible resources. Part of the mental health aspect of this is the fear of not knowing what's going to come next or what's going to happen next. And, you know, as public health leaders, we don't know the answers to all of those questions either, but reassuring your child that we want to be prepared for the pandemic, that your family has a plan, and telling them in an age-appropriate way what that plan is, and reassuring them that there are resources out there. The other part of this is to make sure that you have a routine on a daily basis, especially as summer is coming and school's out. A routine can really help calm those fears, getting back into the way that you're, to the best of your ability, the way that our new normal is going to be, and explaining as clearly as possible, and as to the extent that we know what is happening. Why do we have to wear a face mask in the grocery store, or what are the decisions that we're making for our family, and so that they feel like they're prepared and that the parents can feel prepared as well.
Well, you could not have given me a better cue. Let's take a look at the Triple P Parenting Program and its impact in Cumberland County. As you've said, the program is meant to help reduce adverse childhood experiences by teaching parents effective ways to manage their children's behavior.
Things start at home. Everything starts at home for a child. A lot of times parents are faced with behavioral or emotional issues with their child, and they may not even be aware of some of the signs or some of the triggers or some of the tools or strategies that can be used to not only identify those issues, but then to correct those issues.
I think people think that, you know, well, these kids are going to reach out to teachers and they're going to reach out to people that they trust, but they just don't. You know, they've been told so much what happens in this house stays in this house. So these victims are very different than anybody else in the community because they don't have anybody.
The Triple P program, or Positive Parenting Program, is an internationally acclaimed evidence-based educational and support program for parents and caregivers of children and adolescents. It really is an attempt to further change the culture as it relates to those home environments, making sure that they're nurturing and that they're as conducive as possible for the successful development of children and adolescents in our community.
I really believe over the last 10 years that I've been involved in it that we have seen a culture shift with some entities, some groups that are beginning to recognize, and so I think there's this awareness that's on the ground floor. Hopefully that's about to rise up and become even bigger in our community.
We're approaching it from many different angles. And Triple P is just another angle or another tool, if you will, that our communities will be able to use as we attack that issue.
Paige, you've already noted that stress can chip away at parents' existing capacities to be responsive and warm. And this is true even among those who typically practice these behaviors. How are agencies working today to support the best interest of children by supporting their parents and other caregivers during COVID-19?
It's a really good question. We too at Wake County utilize Triple P. So we not only utilize the approach, but we also train our community partners and stakeholders. It's really important that we also provide one-on-one coaching to support parenting. And during this time with COVID-19, we're providing that parent coaching virtually, as well as during virtual visitations. So we have visitation coaches that are assigned to cases, and they will meet virtually with foster parents and parents prior to the visit, and then even provide support during the virtual visitation. This last week, we just started in-person visits again. And we are ensuring that visitation coaches are there, again, that we are preparing so that our parents, caregivers, and children are managing their own expectations of what that will look like. We hope to promote social distancing. We are providing personal protective equipment for everyone that's involved. But we know that visitation is often the greatest indicator of reunification. So we want to make sure that we're maintaining those connections. And by having those more opportunities to visit and support our parents, we are really hopeful that they are learning techniques and increasing their skills to provide positive parenting, even in times where the stressors are more than normal. But I think it's a really good point that parenting is stressful, even in the best of circumstances. And we don't always get it right. And we need to manage our own expectations there as well, and give ourselves a break and be vulnerable, and be vulnerable with our children, and be realistic and kind and graceful in that, again, we may not be getting it all right, but let's take a break.
Notice
let's
you're
seek
getting
out support.
You're getting the mom nod from all of us on the screen. Yes, it is stressful. Let me just stick with you for a second. You're often preparing children for reentry with their families.
Yes.
How are you preparing them now, recognizing that reentry will not just be into the home, but reentry into what's likely to be an unpredictable and possibly chaotic in-school learning experience?
Well, we still don't know what that may look like. So we're taking the information that we have, we're making sure that we're communicating with our court partners, attorneys, guardian ad litems, as well as with our parents on a regular basis, surveying them as to what their needs are, how they would like to visit, prioritizing that hierarchy of needs, so that if their basic needs are met, they're more equipped to deal with this stressful situation of the unknowns. We also are ensuring that our children have the technology to facilitate that online learning, and communicating with our teachers, and ensuring that our school system understands where our foster care population may be at in reunifying, because school is often that constant. And the school system is such a good partner with us in ensuring the safety and protection of our children that we have to make sure that we're communicating with them around the needs of our this special population that may not respond as well to chaotic situations given their own trauma and history.
And Sharon, I see you nodding. I want to ask you to weigh in on this from your statewide perspective.
What Paige is talking about is really critical. We know that parenting is super hard, and when you're also dealing with trying to juggle possibly working from home at the same time, trying to make sure that your children are continuing their schooling, and if your children are really young, that they're being well cared for and having the attention they need, it's really vital that we give ourselves a break, that we recognize that you cannot be a great employee and a great parent at the exact same time. It's why we have childcare. That's a really, really important piece of the puzzle for a lot of families. So all of that is just critical.
The next question, which comes from Emily in Granite Falls, what are the signs that a child needs counseling, and how can parents with limited income access services for their children?
So we know during this time of the pandemic that families that were not in poverty before might have been thrown into poverty, and we want to continue to make sure that they continue to access mental health services in their community. So some of the signs that we might look for mental health is a change in behavior. Maybe children are becoming more attached to you than they were before, or they're asking questions, or you're seeing a change in behavior in the way maybe they're not sleeping in their bed anymore. We want to look out for those signs and changes in behavior, and listen to your children when they're telling you things. Oftentimes, as a parent, we kind of overlook those changes in behavior when we're busy and we're trying to deal with the pandemic. But we want to take a look at those. And there are some mental health resources out there. Our managed care organizations, Alliance Behavioral Health here in Cumberland County, that can assist with getting families mental health care and counseling, even for those that are low income.
And Sharon, what kinds of resources are you able to share and broker with families across the state?
There are a lot of different resources that include concrete supports for families. A lot of organizations are stepping up to provide food. The Diaper Bank of North Carolina is an incredible resource for young families to get diapers to families that need it, that are struggling financially. And then parenting education and home visiting programs are still operating. So often you can find those through agencies like social services and Smart Start agencies across the state. Accessing programs like Triple P. Circle of Parents is a really wonderful parent support group process that's parent-led and that is available online in communities across the state.
Elizabeth in Chapel Hill asks Sharon, and I'm going to stick with you for a second, what is happening with children in foster care and those at risk for abuse during the pandemic?
I actually think Paige is better to answer that question because she works with children in foster care.
Well, that's a perfect toss. Paige, have you caught it?
Certainly, I got it.
All right, good.
So how we do business with children in foster care has changed a bit while we are experiencing this pandemic. Our federal and state partners are allowing us to see children virtually if they are in a safe placement. But we do continue to provide in-home services and assess abuse and neglect in the field. And if there are any concerns regarding children that are in foster care during that virtual contact, we again are prioritizing that face-to-face contact and are going out into the community, ensuring that our staff have PPEs, or the personal protective equipment, and following up with any of those concerns. We also have paid special attention to our youth aging out of foster care that may not have resources readily available. That's one of the first populations that we surveyed to see how they were doing. As colleges and universities were closing their campuses, we wanted to make sure that their needs were being met. Housing, food, those basic needs that are essential that often our children in foster care are getting through their educational site in living on campus. So there are very diverse needs for children in foster care, and we are modifying our approach week by week and increasing communication just so that we know how our children and youth are doing.
I bet. Jennifer, let's go to you with this next question from Sarah in Gastonia. The question is, how can we support and engage families and children with special needs?
So we've talked quite a bit today about the stress of parents, and that stress is certainly exacerbated if you have a child with special needs, and being able to continue to access those services that your child has, those healthcare services, those prevention services that your child has been in touch with is really important. So we'd encourage any families that have children with special needs to stay connected with your agencies that you've been working with, and ask, if they're not offering, ask, can I do a telephone visit? Can I do a virtual visit? Can we connect via FaceTime? That's going to be a challenge for our folks out that might live in rural communities that don't have the broadband access that others might. But we want to make sure that families stay connected as times of stress increase. That also increases the opportunity for people to, all of us are struggling just to maintain, I think, a little bit of our sanity right now. But when you are in a family that has different needs, that increases. So we want people to make sure that they're staying connected.
Thank you. This next story shares Cumberland County's Community Child Abuse Prevention Plan. Cumberland County was the first in North Carolina to implement such a plan, and it came on the heels of the Shania Davis case.
The Shania Davis case, probably the most recognizable case that we've had in the last 10 to 15 years here in Cumberland County. Shania was a 5-year-old little girl. Shania was abducted from her mother's home. She was taken to a hotel in Sanford about an hour away where she was sexually assaulted. And then the defendant, Mario McNeil, instead of bringing her back to her home, killed her and discarded her body near Sanford. Unfortunately, what we determined is that it was a case of sex trafficking. The mother had willingly given over Shania for the purposes of sex to repay a debt that she had owed the defendant. When thinking about what she went through during those couple of hours that she was abducted, sexually abused, and then murdered, it was just heart-wrenching.
The formation of the community plan started early 2016. I think it was in August. The conversations started in 2013. We were watching the rates of child abuse and neglect go up.
I always say the shelf life for a good youth services detective is probably less than 5 years because it bothers you so much. And because we've never talked about it. You know, we didn't make any change, but I think that we are now. I think our eyes are open, as hard as it is.
There is some good that came from this terrible incident. I know that Shania's family feels that way, that there's awareness brought to this issue. Hopefully it prevents other situations, and also it helps get justice in other situations where something terrible like this occurs.
Jennifer, some experts are concerned that child abuse, including but not limited to sexual abuse, may actually be increasing during the pandemic because vulnerable children are hidden behind closed doors. Could you share with us how the Cumberland County Plan is adapting to protect children in the midst of safer at home regulations?
So I'm not originally from North Carolina, and I am fairly new to this community. And first and foremost, I'm impressed that Cumberland County has made a deliberate and concerted effort to develop a plan that protects children, and not just a plan that sits on the shelf after somebody wrote it, but a plan that's based in evidence, that's evaluated, that adapts and changes. And COVID-19 has highlighted the need for a plan that is active and living. And many of the items that are outlined in the plan have had to adapt in many of the initiatives. For example, we talked about home visiting and pregnancy case management and newborn home visits. Those are things that we've here at the health department and here in the community at Partnership for Children and other agencies have had to quickly shift to making those visits available virtually or online, and then figuring out how are we going to, for those really high risk clients, how are we going to continue to meet with them in person when we absolutely need to. Story times have been facilitated online or on Facebook Live, and we've just made it a different way of learning. We know that pre-K is also really important for children, and that it really gets us off to a good start in life, and has many broad outcomes in terms of health outcomes, but also, of course, educational outcomes as well. And we were very lucky here in Cumberland County that our NC pre-K event happened right before many of the mass gathering orders went into effect. But after that, pre-K enrollment was still important. And so the recruitment for that happened virtually, online or on Facebook, but also relied very heavily on agencies to promote the enrollment of pre-K within their agencies and to the families that they work with. So we've shifted into a virtual mode and used different channels, but that plan is still in place and still active.
We are really happy to hear that. Thank you. I'm going to go to you next, Paige. This question, which comes from Jennifer, is about whether foster placements are being lost because of the added stress of children being home full-time.
It's something that we are continuing to evaluate. We've increased the number of supports to our foster and relative caregivers. We know that when a placement disrupts, it really impacts the well-being of that child for a lifetime. So we are still hosting our child and family team meetings and engaging them in an effort to prevent those types of placement disruptions. I was just looking at the numbers and was impressed that many families are still coming forward. We have now moved our foster parent training to online so that we can continue to engage families in this process to ensure that as families are leaving the system, hopefully for a good reason and that they've adopted a child, that we are still recruiting and we still have that need for placements, especially for sibling groups, older youth, and children with special needs. Some of our partner agencies are struggling and are considering what next steps they'll do. These partner agencies also license foster homes and provide supports to them. But this economic impact has been unprecedented. And we are still adjusting and doing our best, again, to provide supports to our community partners as well as to the foster parents that we're licensing so that we can retain them through this challenging time.
And let me stick with you for a second, Paige, on this next question, which comes from Tesha. Are there specific plans for keeping in touch with displaced children in foster care?
So all of our children that are in foster care, we know where they're at. And we are in constant communication with those families. In regards to their biological families or the families that we had to remove them from to place them in foster care, we are doing both virtual and in-person visits. It was interesting. We received, I think this is some silver lining to this whole pandemic, in that parents were commenting that they, through the virtual contacts, while we may not be able to stay online for an hour, knowing the attention span of our children, they were able to see their child 3 times in a week for a shorter amount of time, and how much they appreciated being able to connect with their children more often. So I think that's definitely a lesson learned that we want to ensure we institutionalize in moving forward. And we now have a greater comfort level from our foster parents, our social workers, our visitation coaches in utilizing these virtual types of interactive resources for maintaining those connections between children and their removal families.
So the next 2 questions from Facebook I put in the category of crystal ball questions. So if you have a crystal ball, go ahead and answer. If not, just say you don't know. So from Jay, what will happen with schools in North Carolina? And I presume this means this coming fall.
I don't think we know that question, the answer to that question yet. We are in the middle of a pandemic, and we've reached out to of course, our local school district, and they've reached out to us here in Cumberland County and many of our other private institutions, and they're asking the same questions. And I think the part that we're trying to work through as the health department is to let's think about, let's put different scenarios on the table and make sure that we're planning for those different scenarios the best that we can. And it, of course, it's going to depend on resources and the comfort level of parents and the age group of the students and what federal and local resources and state resources are available. But unfortunately, I don't have a crystal ball and I don't know what the summer is going to look like for us. And I know that makes it really tough for parents, and it makes it tough for children as they're asking and looking forward to going back to school in many cases. But the answer is right now, we really don't know.
And of course, this follow-up question, which again, I put in the crystal ball category, but you can totally understand where this is coming from. This is Terry, who wants to know whether parents will have an option if they want their child to continue learning remotely.
I don't know the answer to that question either. I think school districts are trying to, and at least the ones that we've been in communication with, are trying to answer that question and want to be able to help parents, especially if you have students that are immune compromised or have some underlying health condition. They want to be accommodating with their attendance policies and want to be able to serve parents, but we just don't know what it's going to look like and where. We don't, of course, yet have a vaccine, and so we're almost a year out from that point right now. And so the schools that we've worked with want to be accommodating and want to help parents, but we just don't have the answers right now.
All three of you have talked about services going online and being able to make connections with children and between children and caregivers using virtual technology. Anita asked via Facebook, what are we going to do to expand access to computers and internet services for low-income families? So how are you facilitating these connections for families who don't have devices or don't have access to hotspots?
That's a really good question. It's really difficult. We're hearing lots of stories of families that are getting in their cars and they're sitting in parking lots at their public library so that they can access free Wi-Fi, or they're going to a local McDonald's to access the Wi-Fi access. It's a really big challenge. It's part of what we're talking about with our advocacy partners across the state, that in order to be able to continue to provide services, particularly to our rural communities and families that don't have computers at home and don't have Wi-Fi, we've got to increase the technology aspect, particularly to our rural, under-resourced communities across North Carolina. That's where we're focusing our efforts at Prevent Child Abuse North Carolina. But a lot of families have been trying to access resources in really creative ways that aren't sustainable.
Paige, Jennifer, do you want to weigh in on that? Go ahead, Jennifer.
Well, in terms of healthcare services, we're facing the same challenges. Many of our families that had difficulties accessing healthcare prior to COVID fall in the same bucket of families that don't have access to internet and aren't able to do a telehealth visit. So we're doing those visits over the phone to the extent that we're able to. And even if I think about our COVID-19 testing here in the community, we have an online assessment for people to fill out before they get tested. You have to go online to do it. But the way we've tried to help families without internet access is to call us at the health department. We'll work it through with you over the phone. So we've tried some phone techniques as well, but agreed, that's a challenge in this virtual world, that if you don't have access, that's going to be a challenge. And it speaks to, I think, the importance of internet access, not just during COVID, but outside of COVID as well.
I'm going to take this next question from Jennifer, and I'll start with you, Paige. The question is, when will day treatment open, and how can we help those families with the most serious cases?
So I don't have the answer around when day treatment services will begin again. We are really fortunate that we, as a system, have approved telehealth for mental health and behavioral health services. So really important for those young people that were accessing day treatment to ensure continuity of services through those virtual connections.
And then the the question about the most serious cases?
The most serious cases?
Yeah.
For those that have been accessing day treatment?
Yes.
I apologize.
So the question is, how can we help those with the most serious cases of child abuse?
I'm sorry.
Go ahead.
Well, we are still out there in the field assessing, being a support to families, ensuring that they have the resources that they need. But it has to be a community response. We all have to be willing to do business differently to be able to support these families. When we look to other family members to be able to provide supports, including placement for these families that are suffering and children that are suffering from abuse. But when that's not possible, that's when we engage our partners at the court and petition for custody and place the child out of their home or out of a kin provider into foster care. So I want to make sure that people understand that there's no waiting list for foster care or any delay because of the pandemic in being able to access services and support. If you have any suspicion of abuse or neglect, please make sure to call and make a report. You don't have to be sure that it's happening, but if you're seeing signs, if you're having concerns, your identity is protected by law, please don't hesitate to call and report.
And of course, Sharon, this is a message that you've been sharing far and wide across North Carolina. Would you talk a little bit about the strategies for getting more people in communities engaged in paying attention and making reports?
Well, I would say first, the most important thing is that we are all connected, but in a physically distant way, but socially connected. We know how important those social connections are, and it can be as simple as picking up the phone and making sure that we're just checking in on one another. No matter what our socioeconomic situation is, this is a really difficult time, as we've all talked about. It's also really important that we know how to recognize and report the signs of abuse and neglect. We have a course on our website that you can take for free. It only takes 2 hours to get through it, and it's really important to understand the signs and to know who to call. It's really important that if you suspect that a child may be in danger in their home, or maybe their family may need support, to call your local Department of Social Services. If you think a child is in immediate physical danger, or you may suspect child sexual abuse may be happening, it's really important to call law enforcement. And then, of course, if it's happening in a child care setting, you would call the Division of Child Development and Early Education. Making sure folks know how to access the resources, recognize the signs, and know where to report is really important.
Thank you. Thank you both. Jennifer, you talked a little bit about childcare and pre-K enrollment, and so I'm going to give you this question from Shelley in Greensboro, which is there any chance attendance requirements will be amended in June for childcare vouchers? Do you know the answer to that?
I don't know the answer to that question. We'll look for some guidance from the North Carolina Department of Health and Human Services on that front, but certainly, the role of the health department is to, once we get that information, to be able to share that out with families that we work with. Child care subsidies and is really important both for the providers and for children, especially in this time of uncertainty and economic instability. But I don't know the answer to that.
Got it. I want to stick with you for this next question, which comes to us from Aaron. What supports are being put in place for children whose parents are suffering mental health issues and are unable to self-regulate, let alone care for their children?
So, as we mentioned, I would encourage families to look out for those behavior changes, those changes in mental health and physical behaviors. And if families are not able to care for their children, to get in contact with your local Department of Social Services. We know that this can be a mentally exhausting time period, and we don't want to create additional stigma for those families that are having mental health challenges. We want them to be able to get help. We also want to make sure that those children are protected and safe during this time. I know local Department of Social Services have plans in place for families that have been impacted by COVID and families are not able to stay in that home because of COVID or because of something COVID related. So we'd encourage families to reach out.
Thank you. Paige, I noted you nodding in the corner, so is there something you'd like to add to that?
Certainly. We're really fortunate in Wake County that we have a prevention services team. So even if you call in or self-report and it doesn't reach that statutory criteria for child abuse or neglect, we're here to provide services and support. And the prevention services worker will do an assessment of what your needs are and connect you with different services, sustainable services in the community to be able to provide immediate and ongoing resources and services during this time.
Sharon, Jennifer, Paige, I want to thank you for spending some time with us. As each of you has mentioned, these are stressful times for families, and it is comforting to know that each of you and so many others across the state are working so very hard to make sure that our children are protected. Thank you.
Thank you.
Thank you for watching and engaging. Solutions are out there if we work together. If you think of a solution or have a comment, I encourage you to visit unctv.org/ncIMPACT. I'm Anita Brown Graham, and this is ncIMPACT.